and I'm going to have like some questions and answers or actions that you can use to help you when you're working at a pharmacy, because that's kind of what was in the book. Like, if this happens, this is what you should do, or if you come in this situation, that's what should happen. So you should go to. Okay. Yeah, it's working. Okay. Oh, but the thing has a. Okay, never mind. About the patient. If you click it again, I think it'll go to that.
Okay, you're kind of in the way.
Talk to us, not the screen.
Okay, so when you're looking at a prescription, is it clear that their name is on there, their full name is, or is there a nickname or initial? And then go, because maybe each one. Okay, so you should always determine the exact name of the patient so that you don't have like 3 or 4 files that different people made because they just put in the name that they thought, or they weren't for sure who to put in, so they have different ones. When checking the patient's file, make sure that you have the date of birth, street address, telephone number, insurance information, if they prefer generic brands over regular brand or vice versa, or if they have any allergy information, because that's important when you fill that out. Okay. You should always confirm the patient's information that is on file. So maybe something's changed that they want to fix on their file, like maybe they have a new allergy or they prefer generic now because it's cheaper. So it's always important. And always double check the date of birth when filling out patient's prescriptions. Maybe somebody, maybe come across when somebody has the same name as somebody else. So that's good. Is the medication over the counter? Can they receive it without a prescription? Only the pharmacist should recommend over-the-counter medicine or determine if they can request it. So you should always check with them before you give them over-the-counter prescriptions. Okay, about the prescription. Is it a Schedule II drug? So remember that those have high potential for abuse and special prescription requirements, because they can addict to them or whatever. Okay. My goodness. Check with the pharmacist on all these because maybe they have had a record for abusing them. You don't want to give those to somebody that has. You should always ask yourself this question, like, was the prescription, how many days has it been since the prescription was written? Because sometimes, there's a certain date that they can get them and sometimes they're not. So maybe if it's old and they want to get that prescription because it's a Schedule II drug, sell it. Some may be valid for months, while others may be valid for 2 days or just that day. So you should always check with the pharmacist to determine that. And what is the quality available to fill? Is the quantity available to fill the needed prescription within the pharmacy? If you think that it's going to be longer to fill it than others, there's special. If you have to do something special, you should always tell them so they're not waiting like in half an hour or hour, so they can go do what they need to do. Suspicions. Do they look suspicious in any way? The patient, maybe they have, like I said, for the Schedule II drugs, maybe they have an addiction. Was it written in all the same handwriting and all the same ink? Because they can change what they had written. Maybe they want more of that, so you should always check for that. So you don't want them to change the quantities, the strength, or the name of drug. And could it be abused, like the Schedule II drugs? Could it be abused, sold, addictive? If you have any of these suspicions or potential forgeries, I can't say that word very well, you should always tell the pharmacist, and they will do what is needed to make sure they're not doing that. And like in the book, it shows handwritten prescriptions. Usually they do, electronically send to the pharmacist or on the computer, or pharmacy, so always check with that. And now you know more about being a pharmacy tech. Yay.